Hello, wonderful listeners. Welcome back to another episode of English in Advance. I am your host, Jessica, and I am so happy you are here with me today. We are going to dive into a topic that is not only useful, but essential for everyone living or traveling in an English-speaking country. Today, we are going to embark on a massive and comprehensive journey through English conversation for health and medicine. This is a special lesson designed for B1 and B2 learners to help you feel confident and calm when you need medical help. Going to the doctor can make anyone nervous, and doing it in a second language is even harder. But do not worry, because by the end of this deep dive, you will have the phrases and vocabulary you need to navigate almost any medical situation smoothly. So sit back, relax, and let us improve your English skills together. To start our journey, let us imagine that you wake up one morning feeling unwell. You decide it is time to see a professional. The first step is almost always the phone call to make an appointment. When you call the clinic or the doctor's office, the receptionist will answer. You want to be polite but clear. A great phrase to start with is simply, "I would like to make an appointment to see Dr. Smith." If you do not have a specific doctor, you can say, "I would like to make an appointment to see a general practitioner." A general practitioner is often called a GP in the United Kingdom or a family doctor in the United States. It is the doctor you see for general health issues. The receptionist might ask you what the appointment is for. You do not need to give a long medical history over the phone. You can just give a brief reason. You might say, "I have a bad fever," or "I have had a persistent cough for 3 days." If the situation is urgent and you feel you need to see someone immediately, you can say, "Is it possible to come in today as it is quite urgent?" However, if it is just a routine visit, for example, an annual physical exam, where the doctor checks your overall health, you can say, "I would like to schedule a checkup." Now let us practice a little bit of timing. The receptionist might offer you a slot by saying, "How about next Tuesday at 3 p.m.? If that time does not work for you, it is perfectly okay to say, "I am afraid I cannot make it." Then, "Do you have anything available in the morning?" This shows you are polite, but also communicates your needs effectively. Remember that clarity is key when speaking on the phone, because you cannot see the other person's face. Once you have successfully made your appointment, the next stage is arriving at the doctor's office. When you walk in, you will see a reception desk. This is where you check in. You can walk up to the receptionist and say, "Hello, I have an appointment at 3 p.m. with Dr. Smith." They will likely ask for your name and date of birth to confirm your identity. In many countries, especially the United States, they will also ask for your insurance card and photo ID. You might hear the phrase, "Please fill out these forms." Do not panic. These forms usually just ask for your medical history, which includes past illnesses, allergies, and current medications. If you do not understand a word on the form, it is perfectly acceptable to ask the receptionist for help by saying, "Excuse me, could you explain what this section means?" After you hand back the forms, you will sit in the waiting room. Eventually, a nurse or an assistant will call your name. They will usually take you to a private room to do some preliminary checks before the doctor sees you. This process is often called taking your vitals. They might check your weight, your height, and your blood pressure. They might say, "I am going to take your blood pressure now. Please roll up your sleeve." They might also take your temperature with a thermometer. This is a good time to take a deep breath and relax. Then comes the most important part, which is talking to the doctor. When the doctor enters the room, they will usually ask a friendly opening question like, "What brings you in today?" or "How can I help you?" This is your moment to describe your symptoms. A symptom is a physical or mental feature that indicates a condition of disease. Common symptoms include a headache, a stomach ache, a sore throat, or a fever. When you describe these, it is helpful to be as specific as possible because it helps the doctor give you the right treatment. Let us look at how to describe pain because pain can feel very different depending on the problem. If the pain is sharp and sudden like a knife, you can call it a sharp pain. For example, you could say, "I have a sharp pain in my side when I breathe." If the pain is not sharp but it is a continuous heavy pain, you can call it a dull ache. You might say, "I have a dull ache in my lower back." Another common type of pain is a throbbing pain. Throbbing means it beats like a heart often used for headaches or injuries. You could say, "I have a throbbing headache that will not go away." Sometimes you need to talk about how long you have been sick. We use the present perfect continuous tense often here. You can say, "I have been feeling dizzy for 2 days." This grammar structure tells the doctor that the dizziness started in the past and is still happening now. It is very useful. Let us try another one. You can say, "I have been coughing since Monday." This is much better than just saying "I cough" because it gives the timeline which is crucial for a diagnosis. The doctor will likely ask you follow-up questions to understand the situation better. They might ask, "Do you have any allergies?" An allergy is when your body reacts badly to something like peanuts or penicillin or cats. You should answer clearly, like, "Yes, I am allergic to penicillin," or "No, I do not have any known allergies." They might also ask, "Are you taking any medication currently?" You should list any pills or medicines you take regularly. During the physical examination, the doctor will give you instructions. These are usually simple imperatives. They might say, "Take a deep breath," or "Open your mouth," and say, "Ah," or "Please lie down on the table." If they want to listen to your heart or lungs, they will use a tool called a stethoscope. They might press on your stomach and ask, "Does it hurt when I press here?" If it does, you simply say, "Yes, it hurts." If it hurts a lot, you can say it is very painful or it is tender. Tender means it is sore when touched. After the examination, the doctor will give you a diagnosis. A diagnosis is the identification of the nature of an illness. They might say you have the flu or you have a sinus infection. Listen carefully here. If you do not understand the name of the illness, do not be afraid to ask, "Could you please write that down for me?" It is your health, so you have every right to understand exactly what is happening. Then the doctor will discuss the treatment plan. This often involves a prescription. A prescription is a piece of paper or an electronic order for medicine that you can only get with a doctor's permission. The doctor might say, "I am going to prescribe you some antibiotics." They will explain how to take the medicine. This is very important listening practice. They might say, "Take 1 pill 3 times a day with food." The phrase "with food" means you should eat something before you swallow the pill to avoid an upset stomach. If they say "on an empty stomach," it means you should not eat right before or after taking the pill. If your illness is caused by a virus like a cold or the flu, antibiotics will not help, so the doctor might recommend over-the-counter medication. Over-the-counter means medicine you can buy at a pharmacy without a prescription. Examples are simple pain relievers or cough syrup. The doctor might say, just get some rest and drink plenty of fluids. Fluids usually means water, juice, or tea. Before you leave, the doctor might talk about a follow-up. A follow-up is a future appointment to check your progress. They might say, come back and see me in a week if you are not feeling better. This is a conditional sentence. It means you only need to return if your condition does not improve. If you feel unsure about anything at the end of the visit, you can ask questions like, should I stay home from work, or are there any side effects to this medication? Side effects are unwanted reactions to a medicine like feeling sleepy or nauseous. Once the consultation is over, you will go back to the reception desk to handle payment or check out. You might need to pay a copay, which is a small fixed amount you pay for a medical service if you have insurance. The receptionist might say that will be $20 for the copay today. You pay and then you are free to go to the pharmacy. But as we all know, health is a vast topic, and sometimes we need to see specialists or deal with very specific situations. So let us expand your vocabulary even further. Let us start with a visit that many people dread, which is going to the dentist. The dentist is the doctor who looks after your teeth and gums. Even if you have perfect teeth, it is common in English-speaking cultures to go for a checkup and a cleaning every 6 months. When you sit in the dentist's chair, the dental hygienist usually cleans your teeth first. They might ask you to open wide. This simply means open your mouth as wide as you can. They might ask, is there any sensitivity? Sensitivity refers to a sharp pain you feel when you eat or drink something hot or cold. You might answer, yes, my back tooth is sensitive to cold water. If you have a pain in your tooth, we call it a toothache. Notice how we use the suffix ache here, just like headache or stomach ache. If you have a toothache, it might mean you have a cavity. A cavity is a small hole in the tooth caused by decay. If the dentist finds a cavity, they will say you need a filling. A filling is the material they put into the hole to fix it. Before they do the filling, they will usually numb the area. Numbing means making the area lose feeling, so you do not feel pain. They might ask, do you want an injection to numb the area? You can say yes. Please, I am afraid of pain. It is always okay to be honest about your fears. Another common dental problem is with the gums, which is the pink flesh around your teeth. If your gums bleed when you brush your teeth, the dentist might say you have gingivitis or gum inflammation. They will advise you to floss more often. Flossing is using a thin string to clean between your teeth. It is a very common question at the dentist, so be ready for them to ask, do you floss daily? You should hopefully say yes, but if not, just say, I try to, but I often forget. Now let us move from our teeth to our eyes. The doctor who checks your eyes is called an optometrist, or simply the eye doctor. If you feel like your vision is getting blurry, meaning things are not clear, you should book an eye exam. During the exam, they will ask you to read letters from a chart on the wall. They might cover one eye and ask, can you read the bottom line? If you cannot see things far away, you are nearsighted. If you cannot see things close up like reading a book, you are far-sighted. If you need help seeing the optometrist, we'll give you a prescription for glasses or contact lenses. Contact lenses are the small plastic lenses you put directly on your eye. A useful phrase here is, I think I need a new prescription. My glasses are not strong enough anymore. Or you might say, I am having trouble driving at night. Being specific about when you have trouble seeing helps the doctor figure out exactly what is wrong. Let us shift gears now and talk about a more urgent situation. What happens if you have an emergency? In the United Kingdom, the emergency department is called A&E, which stands for Accident and Emergency. In the United States, it is usually called the ER, or emergency room. You go here if you have a serious injury or a life-threatening condition. If the situation is very bad, you might need to call an ambulance. The emergency number in the UK is 999 and in the US it is 911. When you call, the operator will ask, "What is your emergency?" You need to be calm and clear. You might say, "There has been a car accident," or "My friend has collapsed and is not breathing." In the emergency room, you might hear the word triage. Triage is the process of deciding which patients need to be treated first based on how sick or injured they are. So even if you arrive first, if someone else comes in with a heart attack, they will be seen before you. This can be frustrating, but it is how hospitals save lives. Common reasons to go to the ER include broken bones, deep cuts that need stitches, or severe chest pain. If you think you have broken a bone, the doctor will order an X-ray. An X-ray is a picture of the inside of your body. They might say, "We need to take an X-ray of your arm to see if it is fractured." Fracture is the medical word for a break in the bone. Now let us step back from emergencies and talk about a very common situation that all English learners will face eventually, which is calling in sick to work or school. When you are feeling unwell and cannot go to your job, you need to inform your boss or your teacher. This is called calling in sick. You do not need to give too much graphic detail. You want to be professional. A great phrase to use is, "I am not feeling well today, so I will not be able to come in." You might add, "I think I have come down with the flu." The phrasal verb "come down with" means you have started to get an illness. If you have a contagious illness, meaning an illness that can spread to other people easily, like a cold or the flu, it is actually more responsible to stay home. You can say, "I have a fever and I do not want to spread it to the team." Your boss will appreciate this. If you need to take a few days off, you can say, "I am taking a sick day today." If you are really sick, you might need a doctor's note. This is a piece of paper from your doctor proving you were sick. Your boss might say, "Please bring a doctor's note when you return." Let us practice describing common cold and flu symptoms, because these are the most frequent reasons for feeling unwell. We already mentioned a cough and a fever. But what about your nose? If liquid is coming out of your nose, you have a runny nose. If your nose feels blocked and you cannot reach air through it, you have a stuffy nose or nasal congestion. You might also sneeze a lot. Sneezing is the sudden explosion of air from your nose and mouth. In English-speaking countries, when someone sneezes, it is polite to say "bless you." You might also have a sore throat. This is when your throat hurts when you swallow. To treat this, you might buy lozenges. Lozenges are small, hard candies that contain medicine to soothe your throat. You can ask the pharmacist, "Do you have any lozenges for a sore throat?" Another common symptom is fatigue. Fatigue is extreme tiredness. You can say, "I feel completely exhausted," or "I have zero energy." When you have the flu, you often have body aches. This means your muscles hurt all over your body. You can simply say, "My whole body aches." Let us take a moment to talk about vocabulary for injuries. Injuries are different from illnesses because they are usually caused by an accident. We talked about cuts and broken bones, but there are others. If you twist your ankle while walking, it is called a sprain. You might say, "I sprained my ankle playing soccer." To treat a sprain, doctors often recommend ice and rest. If you touch a hot stove, you get a burn. Burns can be minor or severe. If it is a bad burn, you might get a blister. A blister is a small bubble on the skin filled with liquid. It is important not to pop a blister because that can cause infection. Now that we have discussed injuries and doctors let us follow the process to the next logical step, which is getting your medicine. We are now heading to the pharmacy. In the United Kingdom and Australia, you will often hear this shop called the chemist. In the United States and Canada, it is almost always called the pharmacy or the drugstore. When you walk in, you will usually see two main areas. The front of the store has items you can pick off the shelf yourself, like shampoo or toothpaste. The back of the store has a high counter where the pharmacists work in white coats. This is where you need to go to pick up your prescription. When you approach the counter, you can say, "I am here to pick up a prescription for your name." It is very common for the pharmacist to ask for your date of birth again to make sure they are giving the right medicine to the right person. Sometimes the doctor prescribes a brand name medicine which can be expensive. A very useful tip for saving money is to ask the pharmacist, is there a generic version available? A generic medicine has the exact same active ingredients as the big brand name, but it costs much less. The pharmacist might say, "Yes, we have a generic version. Would you like that instead?" You can simply answer, "Yes, that would be great." While the pharmacist prepares your medicine, you might have to wait. When they hand you the bag, they will often ask, "Do you have any questions for the pharmacist?" This is your golden opportunity to clarify anything you are unsure about. Do not be shy. You can ask, "Does this medicine have any side effects?" We learned about side effects earlier, but here you might hear specific terms like drowsiness. Drowsiness means feeling sleepy or tired. If a medicine causes drowsiness, the pharmacist will warn you by saying, "Do not drive or operate heavy machinery while taking this." This is a standard safety warning. Another common question to ask is, how should I store this medicine? Most medicines are stored at room temperature, which means just in a cupboard away from heat. However, some special medicines like insulin or certain antibiotics need to be kept in the fridge. The pharmacist might say, "Please keep this refrigerated and shake well before use." Shake well means you need to move the bottle up and down vigorously to mix the liquid inside before you drink it. Let us talk about the different forms medicine can take. We often just call them pills, but there are differences. A tablet is a hard, solid pill. A capsule is usually a small plastic-like container with powder or liquid inside. Sometimes capsules are easier to swallow than tablets. If you have trouble swallowing pills, you can ask, "Is this available in liquid form?" Liquid form is usually called a syrup or a suspension. For skin problems, you might get an ointment or a cream. An ointment is usually greasy and oily, while a cream absorbs into the skin faster. For eye infections, you will get eye drops. A drop is a tiny amount of liquid. Putting in eye drops can be tricky, so you might need to ask a friend to help you. Now I want to focus on reading the label on your medicine bottle because this is where English learners often get confused. The label contains the instructions for dosage. Dosage is the amount of medicine you need to take. You might see the abbreviation mg, which stands for milligrams. You might read, "Take 1 tablet every 4 to 6 hours as needed for pain. Do not exceed 6 tablets in 24 hours. The phrase "do not exceed" is very important. It means do not go over or do not take more than that amount. If you take too much, it is called an overdose, which can be very dangerous. You might also see the phrase "finish the entire course of medication." This is common with antibiotics. It means even if you feel better after 3 days, you must keep taking the pills until the bottle is empty. If you stop too early, the bacteria might come back stronger. So if the label says, take for 10 days, you take it for 10 days. You will also see an expiration date, or expiry date, often marked as EXP. This is the date after which the medicine is no longer safe or effective to use. You should always check this date before taking old medicine from your cabinet. Speaking of cabinets, let us talk about your medicine cabinet at home. Every household should have a basic first aid kit. First aid is the initial help you give to a sick or injured person before professional help arrives. What should be in your kit? You definitely need adhesive bandages. In America, these are called Band-Aids, and in Britain, they are called plasters. You put these on small cuts. You should also have some antiseptic cream or spray to clean wounds and kill germs. You might want some gauze, which is a white cotton fabric used to cover larger wounds, and medical tape to hold the gauze in place. Another useful tool is a thermometer to check for fever. In the past, thermometers were made of glass, but now most are digital and very easy to read. You place it under your tongue or under your armpit. You should also have a pair of tweezers. Tweezers are a small metal tool used for picking up small objects. They are perfect for removing a splinter. A splinter is a tiny piece of wood or glass that gets stuck under your skin. It can be quite painful, but with tweezers, you can pull it out carefully. Moving away from illness, let us switch our focus to staying healthy. We often say prevention is better than cure. This means it is better to live a healthy life than to fix a sick body. When talking about health, we often discuss diet and exercise. Diet here does not necessarily mean trying to lose weight. It just means the food you eat every day. A balanced diet includes a mix of protein, carbohydrates, fruits, and vegetables. If you go to the doctor for a general checkup, they might ask about your lifestyle. They might ask, do you exercise regularly? Useful vocabulary here includes talking about your routine. You can say, I try to do cardio 3 times a week. Cardio refers to exercises that raise your heart rate, like running, swimming, or cycling. It is short for cardiovascular exercise. You might also say, I do strength training or I lift weights. This is exercise to build muscle. If you do not move much, the doctor might warn you that you have a sedentary lifestyle. Sedentary means sitting a lot and not being active. This is very common for office workers, but it is not good for your heart. The doctor might advise you to cut down on certain things. To cut down on means to reduce the amount you consume. They might say you need to cut down on sugar and salt, or they might say you need to quit smoking. Quit means to stop completely. If you are overweight, the doctor might suggest you go on a diet. They might calculate your BMI or body mass index, which is a measure of body fat based on height and weight. Hearing that you need to lose weight can be sensitive, but remember the doctor is giving medical advice, not insulting you. We have talked a lot about general adult health, but we must also talk about taking children to the doctor, which is crucial for any parents listening. Let us begin with the little ones. If you have children, you know that they get sick more often than adults, because their immune systems are still learning how to fight germs. The doctor who specializes in treating babies and children is called a pediatrician. When you have a new baby, you will visit the pediatrician very often. These visits are often called well baby visits or developmental checkups. At these appointments, the doctor is checking to see if the child is growing correctly. They will measure the baby's length and weight. They might ask you, is he eating well or is she sleeping through the night? A common question for new parents is about milestones. Milestones are the big skills a baby learns, like rolling over, sitting up, crawling, and walking. The doctor might ask, has he started crawling yet? One of the most difficult parts of these visits is vaccinations. In the United Kingdom, these are often called jabs, and in the United States, they are called shots or immunizations. It is heartbreaking to see your child cry, but it is for their protection. You might need to hold your child still while the nurse gives the injection. Afterwards, the nurse might give the child a sticker or a lollipop to help them feel better. You might need to ask about side effects here, too. You can ask, will this make him feverish, or is it normal for the injection site to be red? The injection site is simply the place on the leg or arm where the needle went in. Children also suffer from specific illnesses. For example, ear infections are very common. If your baby is crying a lot and pulling at their ear, you might suspect an ear infection. You would tell the doctor she keeps pulling on her ear and she is very irritable. Irritable means easily annoyed or crying more than usual. Another common issue is chickenpox, which causes red itchy spots all over the body, although vaccines have made this less common. There is also colic, which is when a healthy baby cries for a long time, for no obvious reason. If you are a parent, you might feel exhausted, so do not be afraid to tell the pediatrician, I am really struggling with the lack of sleep. They can give you advice on how to cope. When children start school, they often bring home lice. Head lice are tiny insects that live in hair. It is not dangerous, but it is very annoying and itchy. You might need to buy a special shampoo to treat it. You might receive a note from the school saying there has been an outbreak of lice. An outbreak means a sudden start of something like a disease in a group of people. Now let us shift our focus to women's health. Women often see a specialist called a gynecologist or an obstetrician. We often combine these and say OB-GYN. This doctor handles female reproductive health. A routine visit often involves a pee-pee smear, which is a screening test for cancer. It is a bit uncomfortable, but very quick. Women are also encouraged to do breast exams. If you feel a lump, which is a small, hard mass, you must see a doctor immediately. The doctor might order a mammogram, which is an X-ray of the breast. One of the biggest topics in women's health is pregnancy. When a woman is going to have a baby, we say she is pregnant or expecting. You might hear the phrase, when are you due? The due date is the day the doctor thinks the baby will be born. Pregnancy is divided into 3 stages, called trimesters. In the first trimester, many women suffer from morning sickness. Despite the name, morning sickness can happen at any time of day and involves feeling nauseous or vomiting. During the pregnancy, the doctor will use an ultrasound. An ultrasound uses sound waves to create a picture of the baby inside the womb. It is a magical moment when parents can see the baby's heartbeat. When it is time for the baby to be born, the woman goes into labor. Labor is the process of childbirth. It involves contractions, which are strong pains, as the muscles prepare to push the baby out. If the baby cannot be born naturally, doctors might perform a C-section or cesarean section. This is a surgery to deliver the baby. After the baby is born, there is a recovery period. This vocabulary is essential if you are planning a family in an English-speaking country. We must also talk about men's health. Men are often reluctant to go to the doctor, but it is very important. As men get older, they need to check their prostate health. The prostate is a small gland found only in men. A common test is the PSA test, which is a blood test. Men should also watch out for heart health as they are statistically at higher risk for heart attacks. The doctor might talk about high blood pressure, often called hypertension. If you have hypertension, the doctor will tell you to lower your stress and change your diet. They might say you are at risk for cardiovascular disease. This sounds scary, but it is a warning to help you make better choices. Let us move on to a different setting, which is the hospital. Sometimes a visit to the doctor reveals a problem that cannot be treated at home. If you need to stay in the hospital overnight or for several days, you are an inpatient. If you come for a treatment and go home the same day, you are an outpatient. When you arrive at the hospital for a stay, you go through admissions. This is the paperwork process. You will be given a hospital wristband with your name on it. You will be taken to a ward or a room. A ward is a large room with many beds for different patients, usually separated by curtains. A private room has only one bed, but it is usually much more expensive. The nurse's station is the central desk where the nurses work. If you need help, you can press the call button near your bed. Do not be afraid to use it if you are in pain or need assistance going to the bathroom. If you are in the hospital for surgery, you might hear the word operation. Before the operation, you will meet the anesthesiologist. This is the doctor who gives you medicine so you do not feel pain during the surgery. This medicine is called anesthesia. There is local anesthesia, which just numbs one small part of your body, and general anesthesia, which makes you go to sleep completely. The anesthesiologist might say, count backwards from 10, and before you reach 7, you will be asleep. After the surgery, you will wake up in the recovery room. You might feel groggy. Groggy means confused and sleepy. The nurses will monitor your vital signs closely. Once you are stable, you will be moved back to your regular room. During your recovery, the doctor will come to see you. This is called rounds. When doctors do rounds, they visit each patient to check their progress. They might ask, how is your pain level on a scale of 1 to 10? 1 is no pain, and 10 is the worst pain imaginable. It is helpful to give a number so they know how much pain relief medication to give you. Visiting hours are the specific times when your friends and family can come to see you. It is strict in some hospitals, so tell your family, please check the visiting hours before you come. When you are well enough to go home, the doctor will discharge you. Discharge is the formal process of leaving the hospital. You cannot just walk out. You have to sign discharge papers. These papers will have instructions for your care at home. They might say, keep the wound dry or change the dressing daily. A dressing is the bandage covering a surgical cut. Let us talk about medical insurance for a moment, because in countries like the United States, this is a huge part of the hospital experience. You might hear words like deductible and premium. A premium is the amount you pay every month to have insurance. A deductible is the amount you must pay from your own pocket before the insurance company starts paying. For example, if your deductible is $1,000, you pay the first $1,000, and then the insurance pays the rest. You might also hear about networks. If a doctor is in network, it means your insurance covers them. If they are out of network, it might cost you a lot more money. It is always wise to ask, is this procedure covered by my insurance? Finally, let us broaden our horizons even further and start with a topic that is becoming more and more important to discuss openly, and that is mental health. Just as our bodies get sick, sometimes our minds do too, and it is crucial to have the language to talk about it. We've already mentioned anxiety and depression earlier, but let us go a bit deeper. Someone suffering from anxiety might experience panic attacks. A panic attack is a sudden feeling of intense fear that can cause physical symptoms like a racing heart and shortness of breath. You might hear someone say, "I feel like I cannot breathe," or "my heart is pounding out of my chest." Another common issue is stress management. When life becomes too much to handle, we say we are overwhelmed. You might say to a friend, "I have so many deadlines at work, I feel completely overwhelmed." This can lead to burnout, which we discussed as a state of exhaustion. To combat this, people often seek therapy or counseling. A therapist is a trained professional you talk to about your problems. You might hear someone say, "I see a therapist once a week to talk about my anxiety." It is a very positive step to take. We also talk about coping mechanisms. These are the strategies we use to deal with stress and difficult emotions. Some are healthy, like exercise or journaling, while others are unhealthy, like drinking too much alcohol or emotional eating. You might hear someone say, "Running is my coping mechanism for stress." If someone is going through a very difficult time, like a divorce or the death of a loved one, we say they are grieving. Grief is the deep sorrow you feel after a loss. A useful phrase to offer comfort is, "I am so sorry for your loss. I am here if you need to talk." Now let us shift gears to a different approach to health, which is alternative and holistic medicine. In many English-speaking countries, people use these alongside conventional Western medicine. Conventional medicine is what you get at a regular hospital with drugs and surgery. Alternative medicine includes things like acupuncture. Acupuncture is a traditional Chinese medicine technique that involves inserting very thin needles into specific points on the body to relieve pain or balance energy. You might hear someone say, "I am trying acupuncture for my back pain." Another popular practice is chiropractic care. A chiropractor is not a medical doctor, but a specialist who focuses on the spine and joints. They perform adjustments to align the body. You might say, "I am going to see the chiropractor to get my neck adjusted." Then there is herbal medicine. This is using plants and plant extracts for healing. For example, many people drink chamomile tea to help them sleep or take echinacea to fight a cold. You might hear someone say, "I prefer natural remedies, like herbal tea over prescription drugs." We also have homeopathy, which is a system of medicine based on the idea that, like cures, like using highly diluted substances. And let us not forget meditation and mindfulness. Mindfulness is the practice of being present in the moment. It is often used to reduce stress. You might hear someone say, "I practice mindfulness for 10 minutes every morning to start my day calmly." Yoga is another hugely popular practice that combines physical postures, breathing exercises, and meditation. You might say, "I am going to a yoga class to stretch and relax." To wrap up our comprehensive lesson, let us have some fun with language. English is full of idioms that use body parts. These idioms are not meant to be taken literally, but they are incredibly common in everyday conversation. Knowing them will help you understand native speakers much better and sound more advanced yourself. Let us start with the head. If something goes over your head, it means you do not understand it because it is too complex. For example, the lecture on quantum physics went completely over my head. If you are trying hard to remember something or solve a problem, you might rack your brain. For example, I have been racking my brain all day trying to remember her name. If you keep a cool head, it means you stay calm in a difficult situation. For example, even during the emergency, she kept a cool head and called for help. Now let us move to the eyes. If you see eye to eye with someone, it means you agree with them completely. For example, my boss and I do not always see eye to eye on strategy. If you catch someone's eye, it means you get their attention by looking at them. For example, I was trying to catch the waiter's eye to order the bill. If you turn a blind eye to something, it means you choose to ignore something that you know is wrong. For example, the teacher turned a blind eye to the students passing notes in class. Let us talk about the ears. If you are all ears, it means you are listening very eagerly and attentively. For example, tell me about your trip. I am all ears. If something goes in one ear and out the other, it means someone is not listening or quickly forgets what is said. For example, I tell my son to clean his room, but it just goes in one ear and out the other. If you play it by ear, it means you decide what to do as a situation develops, instead of having a plan. For example, we do not have a set plan for dinner. Let us just play it by ear. How about the nose? If someone is being nosy, it means they are too interested in other people's business. You might say, "Stop being so nosy, it is none of your business." If you have a nose for something, it means you have a natural ability to find or recognize it. For example, that journalist has a nose for a good story. If you look down your nose at someone, it means you think you are better than them. For example, she looks down her nose at anyone who does not drive an expensive car. Let us look at the mouth and tongue. If a name or word is on the tip of your tongue, it means you know it, but cannot quite remember it at that moment. For example, his name is on the tip of my tongue. It starts with B. If you bite your tongue, it means you stop yourself from saying something that might cause trouble or hurt someone's feelings. For example, I wanted to argue with him, but I decided to bite my tongue to avoid a scene. If something makes your mouth water, it means it looks or smells delicious. For example, the smell of freshly baked bread makes my mouth water. Moving down to the chest and heart. If you get something off your chest, it means you talk about something that has been worrying you, and you feel better afterwards. For example, "Thank you for listening. I really needed to get that off my chest." If you have a change of heart, it means you change your opinion or decision about something. For example, at first I did not want to go to the party, but I had a change of heart and went anyway. If your heart is in the right place, it means you have good intentions, even if your actions do not always turn out perfectly. For example, he can be a bit clumsy, but his heart is in the right place. Finally, let us look at the arms and legs. If something costs an arm and a leg, it means it is very expensive. For example, that new car cost him an arm and a leg. If you are pulling someone's leg, it means you are joking with them by telling them something that is not true. For example, "I did not really win the lottery, I was just pulling your leg." If you stand on your own 2 legs or 2 feet, it means you are independent and can take care of yourself. For example, it is time for him to get a job and stand on his own 2 feet. Now let us take a very practical turn and talk about the fuel we put in our bodies, which is nutrition, and how we keep our bodies strong, which is fitness. We will also discuss a very tender topic, which is caring for our aging population, and finally look at the future of medicine with technology. These are conversations you will have constantly in your daily life, so mastering this vocabulary is a game changer for your fluency. Let us begin in the kitchen because good health starts with what we eat. You've probably heard the saying, "You are what you eat." When talking about food and health, we often talk about nutrients. Nutrients are the substances in food that our bodies need to function. We have macronutrients, often just called macros. These are carbohydrates, proteins, and fats. Carbohydrates or carbs provide energy. You find them in bread, pasta, and rice. Proteins build muscle, and you find them in meat, eggs, and beans. Fats are essential for brain health, and you find them in oils, nuts, and avocados. A nutritionist is a specialist who helps you plan what to eat. They might tell you to eat a balanced diet. A balanced diet means eating the right amount of food from all food groups. In English-speaking cultures, you will encounter many people with specific dietary requirements. Some people are vegetarians, meaning they do not eat meat. Some are vegans, meaning they do not eat any animal products at all, including dairy and eggs. You might hear someone say, "I am vegan, so I cannot eat that cake if it has eggs in it." Then there are medical restrictions. If someone cannot digest the sugar in milk, they are lactose intolerant. They might drink almond milk or oat milk instead. If someone cannot eat gluten, which is a protein found in wheat, they are gluten-free, or they might have celiac disease. It is very important to ask guests, do you have any dietary restrictions before you cook for them? When you are grocery shopping, reading the nutrition label is a great way to practice English. You will see the word calories. A calorie is a unit of energy. If you are trying to lose weight, you might be counting calories. You should also look for preservatives. These are chemicals added to food to make it last longer. Generally, doctors advise us to avoid processed foods, which are foods made in a factory, and eat more whole foods like fruits and vegetables. You might hear the phrase organic food. Organic means the food was grown without synthetic pesticides or chemicals. It is usually more expensive, but many people believe it is healthier. Let us transition from food to movement. Fitness is a huge industry, and the vocabulary here is very useful. If you join a gym, you will likely have an induction. An induction is a tour where a staff member shows you how to use the equipment safely. You might use a treadmill, which is a machine for running in one place. You might use an elliptical, which is a machine that mimics walking without impact on your joints. Or you might go to the free weights section. Free weights are dumbbells and barbells that are not attached to a machine. If you are lifting heavy weights, you might ask someone to spot you. To spot someone means to watch them and help them if the weight becomes too heavy so they do not get hurt. You could say, "Excuse me, could you spot me for this set?" A workout usually consists of sets and reps. Reps is short for repetitions. So if you lift a weight 10 times, that is 10 reps. If you do that 3 times with a break in between, that is 3 sets. Before you start exercising, you must warm up. A warm-up is gentle movement to prepare your muscles. After you finish, you should cool down and stretch. Stretching helps prevent stiffness. If you work out very hard, you might feel sore the next day. We often call this DOMS, which stands for Delayed Onset Muscle Soreness. You might say, "I can barely walk today because I did leg day yesterday." There are many idioms related to fitness. If someone is in very good shape, we say they are fit as a fiddle. If someone is very strong and muscular, we might say they are ripped or shredded. If someone has a lot of endurance, meaning they can run for a long time, we say they have great stamina. Conversely, if someone is out of shape and gets tired easily, we might say they are unfit. A very common phrase is, "No pain, no gain." This means you have to work hard and suffer a little to get results. However, be careful, because real pain can mean an injury. If you feel a sharp pain, stop immediately. Now let us move to a more serious and compassionate topic, which is senior care or geriatrics. Geriatrics is the branch of medicine focused on elderly people. As people age, they face specific health challenges. One of the most common is arthritis. Arthritis is inflammation of the joints causing pain and stiffness. You might see an older person using a cane or a walker to help them move. These are called mobility aids. If someone cannot walk at all, they might use a wheelchair. It is polite to ask, would you like some assistance before helping someone with a mobility aid? Another major issue is dementia. Dementia is a general term for a decline in mental ability severe enough to interfere with daily life. Alzheimer's disease is the most common type. A person with dementia might be forgetful or confused. Caring for someone with dementia requires a lot of patience. You might hear about a caregiver or a carer. This is a person, often a family member, who looks after a sick or elderly person. It is a very demanding job. Sometimes when an elderly person can no longer live alone, they move to a retirement home or a nursing home. A nursing home provides 24-hour medical care, while a retirement home is more for independent living with some support. Sensory loss is also common as we age. Many older adults experience hearing loss and wear a hearing aid. A hearing aid is a small electronic device worn in or behind the ear. If you are speaking to someone with a hearing aid, speak clearly and face them, but do not shout. Vision loss can lead to conditions like cataracts, which makes vision cloudy. Fortunately, cataract surgery is very common and successful. When talking to older people about their health, it is important to be respectful. Instead of saying you are getting old and weak, you can say you are experiencing some age-related changes. Finally, let us look at the cutting edge of health, which is medical technology. The world of medicine is changing fast. One of the biggest changes is telehealth or telemedicine. This is when you see your doctor over a video call instead of in person. It is very convenient for minor issues. You might say, I have a virtual appointment with my doctor at 2 p.m. During a virtual visit, you need to be very good at describing your symptoms because the doctor cannot touch you. You might need to send them photos of a rash or measure your own temperature. We also see a rise in wearable technology or wearables. These are devices like smartwatches that track your health data. They can monitor your heart rate, your sleep quality, and your steps. You might hear someone say, "My watch says I have only walked 3,000 steps today. I need to go for a walk." Some advanced wearables can even detect an irregular heartbeat and alert you to see a doctor. This is called preventative monitoring. Another exciting area is personalized medicine. This involves using your genetic information to tailor treatment specifically for you. You might hear about DNA testing kits that tell you about your ancestry and your health risks. For example, a test might reveal you have a genetic predisposition to high cholesterol. A predisposition means you are more likely than average to develop a condition. Knowing this can help you make lifestyle changes early. Let us do a little role play to practice this new vocabulary. Imagine you are at a restaurant with a friend who has allergies. You need to ask the waiter about the food. You could say, "Excuse me, my friend has a severe peanut allergy. Can you please check if this dish contains any nuts or if it was cooked in peanut oil?" The waiter might say, "Let me double check with the chef." This is a life-saving conversation. Now imagine you are talking to your grandmother who is having trouble walking. You could say, "Grandma, I noticed you are struggling with the stairs. Would you consider getting a stair lift installed?" A stair lift is a mechanical chair that carries a person up and down stairs. It is a gentle way to suggest help. We've covered nutrition from calories to gluten-free. We have sweated out in the gym with reps and sets. We have discussed the sensitive world of senior care and looked into the digital future of health. This vocabulary adds so much depth to your English. It allows you to talk about lifestyle choices, family responsibilities, and modern trends. Let us revisit the dentist because dental health is such a specific area with its own language. We talked about cavities and fillings, but there is more. Sometimes a tooth is too damaged to be fixed with a filling. In that case, you might need a crown. A crown is a cap that covers the whole tooth to make it strong again. If the damage goes deep into the root of the tooth, you might need a root canal. This sounds scary, and it can be painful, but it saves the tooth. The dentist removes the infected pulp from inside the tooth. You might hear them say we need to perform a root canal to save this molar. Molars are the big flat teeth at the back of your mouth used for chewing. Sometimes people want to improve the look of their smile. This is called cosmetic dentistry. A popular procedure is teeth whitening or bleaching to make teeth brighter. Another option is veneers. Veneers are thin shells of porcelain that stick to the front of your teeth to give you a perfect Hollywood smile. If your teeth are crooked, meaning they are not straight, you might need braces. Braces are the metal wires and brackets that pull teeth into position over time. Nowadays, many adults prefer clear aligners, which are invisible plastic trays that do the same job. You might hear someone say, "I am wearing my aligners, so I cannot eat right now." Wisdom teeth are another common topic. These are the last molars to grow, usually in your late teens or 20s. Often there is not enough room in the mouth for them, so they become impacted. Impacted means they are stuck under the gum. If this happens, you need to have them extracted. Extraction simply means pulling the tooth out. After an extraction, you will have stitches in your gum, and you will have to eat soft foods like soup and yogurt for a few days. You might get a prescription for painkillers because the recovery can be sore. Now let us tackle the beast that is medical billing and insurance, especially if you are in the United States. We touched on premiums and deductibles, but let us go deeper. When you receive a medical service, you often get an EOB or explanation of benefits in the mail. This is not a bill. It is a document showing what the doctor charged, what the insurance paid, and what you owe. You might see the term out-of-pocket maximum. This is the most you will have to pay in 1 year. After you reach this amount, the insurance pays 100% of your costs. It is a safety net. Sometimes a claim is denied. A claim is the request for payment sent to the insurance company. If it is denied, it means they refuse to pay. This can happen for many reasons. Maybe the service was considered not medically necessary. This is a phrase they use to say you did not really need the treatment for your health. For example, cosmetic surgery is almost never covered. If this happens, you can file an appeal. An appeal is a formal request to have them look at the decision again. You might need to call the billing department and say, "I think there has been a mistake with my bill. I would like to appeal this denial." You might also hear about co-insurance. This is different from a co-pay. Co-insurance is a percentage you pay after you meet your deductible. For example, if your plan pays 80%, you pay the remaining 20%. That 20% is your co-insurance. It is confusing math, so do not feel bad if you need to ask someone to explain it. You can say to the hospital administrator, "Could you please walk me through these charges? I do not understand what I am paying for." To walk someone through something means to explain it step by step. Now that we have covered the hard stuff, let us do a massive review and consolidation. We have learned that communication is not just about vocabulary, it is about strategy. Strategy number 1 is preparation. Before you go to the doctor, write down your symptoms. Write down your questions. If you are nervous, practice saying them out loud. Strategy number 2 is clarification. Never pretend to understand if you do not. Use phrases like, "Could you say that in simple terms, please?" Or does that mean I have to stop taking my other medicine? Strategy number 3 is support. If you can take a friend or family member with you, they can be your second pair of ears. Let us review some of the most critical red flag symptoms we learned. These are the ones you must never ignore. Shortness of breath means you cannot get enough air. Chest pain or pressure can be a sign of a heart attack. Slurred speech means you are not speaking clearly and can be a sign of a stroke. Severe abdominal pain could be appendicitis. High fever, especially in children, needs attention. If you see or feel any of these, do not wait. Go to the ER or call emergency services. Knowing these words can literally save a life. We also learned about the importance of preventative care. This includes your annual physical, your dental checkups, and your eye exams. It also includes your lifestyle choices. Remember the vocabulary about nutrition like balanced diet and hydration. Remember the fitness terms like cardio and strength training. And do not forget mental health. Managing stress, avoiding burnout, and seeking therapy are all part of being healthy. I want to leave you with a final thought about the human side of medicine. Doctors and nurses are people too. They are often working long hours and are under a lot of stress. A little bit of kindness goes a long way. Saying thank you for your help or I appreciate your time can make the interaction much smoother. If you are a patient who is polite and cooperative, you will often get better care because the staff will want to go the extra mile for you. To go the extra mile means to make a special effort. So what is your next step? You have listened to this series, you have practiced the phrases, now you need to live it. If you are living in an English-speaking country, do not be afraid to make that appointment you have been putting off. If you are learning from your home country, use these resources to watch medical dramas like Grey's Anatomy or The Good Doctor. You will be amazed at how much you now understand. You will hear triage and stat and intubate, and you will know exactly what is happening. This brings us to the end of our episode. It has been an absolute honor to guide you through this complex and vital topic. I hope you feel armed with knowledge and ready to face any medical situation with your head held high. I am Jessica, and this has been English in Advance. Thank you for your time, your attention, and your trust. Keep learning, keep growing, and most importantly, stay healthy. Until our next adventure together, goodbye.